Hi there, and welcome to the HDFS Career Podcast. My name is Dr. Lori Bullock, and I'm an assistant professor in Human Development and Family Studies at MSU. I teach several courses in the department, and one of them is HDFS 270, which introduces students to this major and to the field of family science. Quite often, students who are new to our major are not quite sure of the career options they have with a degree in human development and family studies. Some students know exactly what they want to do, and some students aren't quite sure and can sometimes feel overwhelmed. And there are other students who are in our major but plan to pursue a career in the healthcare field. These would be students who know that they want to be nurses or doctors or child life specialists, occupational therapists, and so on. The purpose of this podcast is to bring professionals on from many different areas. Each episode, I invite a professional from the community who has a background in HDFS or one that is similar to HDFS. I'm so excited you joined the podcast, and I hope today's episode will be helpful to you as you consider your career options. Hello, HDFS students and colleagues. I'm really excited for you to meet today's guest on the podcast. Her name is Meghan Rich, and she is a speech language pathologist. So a little bit about her. She's a speech language pathologist who specializes in orofacial myofunctional disorders. Using an interdisciplinary approach, Meghan approaches therapy from a strengths-based and neurodiversity-affirming holistic lens. Meghan earned her bachelor's degree in human development and family studies right here at MSU with a minor in communication sciences and disorders. And then she went on to earn her master's degree in speech and language pathology from the University of Toledo. Meghan completed internships at Sara's Garden, ProMedica Hospital, and Emerge Pediatric Therapy. She then completed, her clinical fellowship year with Emerge, where she currently works. Meghan has a lot of experience. She has experience in treating phonological disorders, expressive and receptive language disorders, fluency disorders, dysarthria, autism spectrum disorders, aphasia, traumatic brain injuries, dysphagia, and orofacial myofunctional disorders. She is also trained in using alternative and augmentative communication programs such as LAMP Words for Life, TD Snap, Proloquo to Go, and TouchChat WordPower. Meghan continues to strive to enhance her skills as a speech language pathologist and to provide the best possible interventions for her clients. Meghan, thank you so much for joining the podcast today and to share your experiences. I'm really excited to have you here today and for my students to learn from you.
Yeah, thank you so much for having me. I'm excited to talk about what it's like to be a speech therapist.
Yes, I know I have students who are going to be very interested in that. I got to ask, did I mess up any of those words when I was reading your bio?
You said everything perfectly.
Okay, great. I'm glad. I have a little bit of a medical background, so I try when it comes to terminology like that. So first of all, because my students are going to be very interested in finding out about what you do, can you talk a little bit about you, describe you and what you do, your current role?
Yeah, so I am a pediatric speech and language pathologist. I work at a pediatric outpatient clinic here in Durham, North Carolina. So it's a sensory-based clinic that offers speech therapy, occupational therapy, and physical therapy. I treat clients ranging from 1 year old into my current client, that's the oldest, is about 13. And then you kind of went ahead and listed in my bio all the different things that I'm able to treat. But yeah, just kind of day to day working with kiddos, um, doing treatment sessions, documentation, um, evaluations, all the things. But it's great being in a sensory clinic and being able to offer some kids who have some sensory differences a space to kind of regulate themselves while also becoming an effective communicator.
Yeah, that sounds really interesting. So it sounds like the clinic you said outpatient, so it's not within a hospital setting. Is that
Right.
correct?
Yeah, we're a standalone clinic, so clients are traveling to us to our clinic space and receiving therapy there.
Okay. And what I like about it is that sounds like you've got some wraparound services, um,
Mhm.
like you said, with occupational therapy and physical therapy, along with the services that you provide, the therapy services you provide. So that's nice
Mhm.
that they have one place to go to be able to get all of those if they need them.
Yes, it's very beneficial too if we have some clients who benefit from co-treatments as well. So that might be where I'm treating alongside an occupational therapist or alongside a physical therapist as well to kind of help treat more than one thing at a time.
Yeah, I bet that really helps. I mean, because I would imagine otherwise families would have like lots of different appointments at different places. And so this just kind of provides us, one central location for those types
Mhm.
of services.
Yeah.
Yeah, that's really great. That's awesome. Um, so can you talk a little bit about what does a typical day look like for someone in your position?
Yeah. So I currently treat a caseload of 43 clients. And I am in treatment sessions for 30 minutes at a time. So we'll treat for roughly 25 minutes, and then those last 5 minutes are used for parent education and kind of home program development that the family can carry over for the rest of that week. Um, and then I might be doing some documentation when I have some downtime. I might be doing an evaluation one day, which are hour-long sessions, paired with some post-evaluation discussion with the parents. And then I might also be doing some observations of other clients, especially since I have that specialization in OMDs. So if I have another speech therapist at our clinic who has some speculation that one of their clients might have an OMD, they might ask me to come in and do a quick observation and see if that client should then be referred for a full OMD evaluation. But that's kind of mostly what my day-to-day consists of is treatment, documentation, evaluations, observations,
Okay, sounds great. So for most patients, or client, do you call them patients or clients?
clients.
Clients, okay. I know it's different with every field.
Mhm,
So, how typically do they come like a couple of times a week or once a week? Or does that
mhm.
vary?
It varies client to client. It depends on after the evaluation, if we determine if their severity would be cleared enough by their insurance to be seen multiple times throughout a week. So typically, if a client would be determined moderate to severe on kind of their diagnosis, we would recommend twice a week services. If they're more leaning towards mild, probably just the one time a week.
Okay, great. That's good to know.
Mhm.
Um, so let me look. I'm just trying to look at my next question a little bit. So, what made you choose this career path? Were there any defining experiences in college? How did you choose this?
Yeah, so actually, my oldest sister is a speech therapist as well. And I knew I always wanted to do something in the medical field. So right before I went to college, she was like, come out, shadow me, see if that's something you'd be interested in pursuing. And I did, and I was like, this is pretty cool. So then I enrolled in one of Michigan State's Intro to Communication Sciences and Disorders courses. And that's kind of when I just fell in love with it and was like, this is what I want to do. I'm just going to do the CSD minor. And then I had to decide, what was my major going to be. So that's when I landed on HDFS because I felt like a good match, like to supplement, I guess, communication sciences and disorders since I'd be working so closely with children throughout their life and then families as well. So it was kind of a good pairing together when I decided to do both.
Oh, that's great. That makes me wonder. So what aspects of HDFS have been really helpful for you in your career?
Yeah, I would say thinking back to the courses I had taken, um, learning about like family dynamics because you do see such a wide variety of families that come into a clinic, and knowing how to kind of navigate those. Also knowing how to support families through some possible difficult diagnoses that their child may receive, and to kind of help them through where to find certain support systems, whether that be through Medicaid services, or other clinics in the area. So just kind of knowing how to navigate those situations for families, and then also having background knowledge of child development as well, because that was also covered throughout HDFS.
Yeah, I could see where that would be usually really helpful. And I would imagine, have you had to help parents through somewhat of a grieving process sometimes?
Yeah, it can be difficult for parents when they receive a diagnosis for their child that they weren't necessarily expecting. So kind of helping them navigate, almost like a grieving of what they expected their life to kind of, they envisioned it to look like, and now kind of what the reality might be. But kind of helping them see positives and what is to come for their kid, and what positive outcomes can come from receiving speech therapy and occupational therapy and physical therapy.
Yeah, I could see that. And I could also see, like, on the flip side, maybe it's somewhat of a relief to finally know.
Mhm. Yeah, there have been, quite a few families who come in and they're like, we haven't been getting any answers about this, and it could be this, it could be this. And especially for like OMDs, clients will come in and they're not making any progress in articulation therapy. And then I do an OMD evaluation and I go, they have a tongue tie, which is severely impacting their ability to make certain speech sounds. So then the parents are then, that's kind of a relief to be like, oh, there's something we can do about it. And then that will help them progress into being more intelligible.
That's great. That's great. Yeah, and I could see where that would be a relief for the parents.
Hmm.
Just because it's helpful when you know that there's something you can do to help your child. So that's
Yes.
awesome. Great. So I want to switch gears a little bit, if it's okay, and talk about that transition to grad school. Can you talk a little bit about what that was like for you?
Yeah. It was definitely a big change. You're kind of more so on your own in graduate school. I mean, you do still have this a big support system of your classmates and your professors and counselors, but you're kind of starting to figure out how you fit as a new professional, and trying to figure out what that kind of means for yourself. So it was it was tricky to navigate it, but I think it was really helpful to have such a strong support system of my professors who were encouraging me that, yes, you do know what you're talking about, and you know what you're doing. Or when there were those instances where I wasn't quite sure where to go next with one of my clients, they were there to kind of help me along as well. But yeah, definitely a big change. But I was able to kind of adjust where needed, I think, pretty well.
That's great. That sounds great. So for your program, your degree program, did you start right out being able to have contact with clients, or did you have a set of coursework you had to complete first, and then
Mhm.
where you would start to be able to interact with clients?
Yeah, so the way it was set up at University of Toledo was we did a semester of only coursework. We were just taking everything in, learning about all the different approaches to therapy. And then the second semester, we would take on one client at the in-house clinic at University of Toledo. And we were under direct supervision of a supervisor. So it was kind of like an intro to like how to provide therapy to clients, with just a lot of supports, pretty much. And then as the semesters went on, it was kind of less and less supports. You're more on your own with these two or three clients now under supervision. And then by the time I went to my internships, I was managing bigger caseloads of clients, but still under supervision of someone, checking on my notes and signing off on all of those, signing off on the hours I had earned. Um, and then you go into your clinical fellowship year after you take your praxis exam. So that's basically the standardized assessment that says, yes, you knew everything from graduate school, you're competent in all of these areas, you have all the background knowledge. Now go out into the world and apply it. So then you complete your clinical fellowship year, which is still under supervision, but it's less direct supervision hours, I would say, where your supervisor has to be there with you and you're managing a full caseload. But they're still signing off on everything until you earn your clinical competence certificate. So that's when you earn the C's after your name and you are deemed a fully clinically competent speech therapist.
Okay. Does that involve another exam at that point, or it's mostly of when your supervisor says, yes, you've checked all these boxes from my,
Right. It's when your
from what I see.
supervisor says yes, and then you actually submit it to the American Speech and Hearing Association, so ASHA, and then they will process your application and say, yes, you've earned all your hours, you've done everything you needed to do. Here are your C's. You're now a speech therapist. And then for your state, you'll have to get your licensure as well to be able to legally practice in the state.
Okay. And so what is involved with that? Is it like something you like a form you apply for, possibly a
Yeah,
fee?
it's pretty much saying, I have my C's now. I'd like to practice in this state. I'm a resident, and then you pay like a small fee to have your license. There is what they call continuing education courses that you have to maintain throughout. They do it in 3-year chunks. So over the course of 3 years, you have to complete 30 hours of continuing education. Basically so that you're just up to date on the current practices of speech and language pathology. And those hours, once you have them completed, are required to keep your license valid. So you have to be doing those every 3 years to be a practicing SLP.
Okay. And so how do you get those? Like through conferences
Mhm.
or?
Yeah, they can be through conferences. They can be through other professionals who may come and present at your clinic or wherever you're working. You can find a lot of courses online as well through ASHA or through other organizations. So I took my course on orofacial myofunctional therapy, and that counted as a good chunk of my hours towards maintaining my license.
Okay. Really good information. Really good
Yeah.
details. Thank you. I do wonder, I want to go back a little bit. I think students, our current students, are going to wonder so if they've had a job during undergrad. If you're going through a program like yours, do you have time to have a job on top of that, or how does that work?
Right. So I did have a job on top of graduate school and my internships. Wasn't a super taxing job. I just worked for our in-house clinic, just doing some reception work and client intake forms. Um, but I would say, I still took out loans to pay for graduate school, but I did have quite a few classmates who were working other jobs as well, and made it work. Because our internship hours were pretty understanding of we have to also have a job to be able to pay for graduate school. So they were pretty understanding of working out a flexible schedule for students.
Okay, that's good. Good to know. And when you first started grad school, was there like, um, did you need to learn a new balance of how to manage your time with studying, and working, and then, starting to fit in some of those clinical hours as you went along?
Mhm. Yeah, I think the biggest thing was once I started to do internships on top of coursework and projects, that's when I started to really have to figure out how to manage my time a bit better. Because your internship is basically a job on top of another job you're working, and then you still have coursework to complete. Um, so yeah, definitely having to kind of finesse when I was going to get stuff done, but also carve out personal time because that's important as well. Um, but I think it took some, talking and conversations with like some other students and how they might have been managing it, and also my professors and what they kind of recommended I do to kind of help manage some stress I might have been feeling during a really busy time of the year where we had a lot of projects and assignments coming up. But they were all really great with helping us through those times and giving us some great feedback.
Great. So you reached out then to others, and that really
Yeah,
was helpful. Good.
yeah,
Good. I think it's important that students learn to do that. I think quite often they kind of try to do it all on their own without saying anything, and
hmm
could really get stressed.
yeah.
Okay. Um, so so that in a related question though, since you completed your degree and you're working in your career, what has work-life balance been like for you? Are there like certain strategies where you make sure you get your personal time, or
Mm-hmm.
what has that been like?
Yeah, I starting off, it was tricky because I wanted to just get everything done as fast as I could. And like, even if that meant if I didn't finish my daily notes, I had to bring work home and then stay up throughout the night trying to get documentation done. That caused a lot of stress on me. And so I had to really kind of take a step back and look and say, this probably isn't the healthiest work-life balance. So I gave myself some leeway to say, during these times when I have my morning break and afternoon break, that's when I really buckle down, get all my documentation done, so that by the end of the day, I have at least a majority of my stuff done. And if it has to go into the next day, it does. And it's not the end of the world if I don't get everything done, because by the end of the week, I do manage it. I get it done and it's fine. But yeah, it's really just kind of giving yourself some grace and forgiveness too, because it is important to have that work-life balance and carve out time for friends and family. Um, but I also found it really helpful. I worked with my clinic on kind of changing my schedule in a way that it worked better for me. So I actually work only 4 days a week and then have a 3-day weekend. So they were okay with me working 4 10-hour days, and then I had my 3-day weekend. And that seems to be a better fit for how I, kind of function in the workplace, and then go and have my 3-day weekend to kind of recoup mentally and physically, and then be ready for another 4-day week.
Great. Oh, I'm glad you talked about that, because I
Mhm.
think that is very important to do. It can be really easy to get caught up into just feeling like you have to work all the time.
Yeah.
Yeah. So good. I'm glad you're able to find that balance then. So you talked about I'm looking at my questions here. You kind of talked about your licensure and your accreditations. So with your program, were there study materials that you used to prepare for the exam that you had to
Mhm.
take, and things like
Yeah.
that?
Yeah. So this was really tricky, and I felt really overwhelmed at first because you do learn so much throughout undergrad and graduate school, since we do cover birth to death, like the whole lifespan, all these different subcategories of speech therapy. So it's kind of like, where do you even start? So I looked into study prep materials like through other companies, and I used one that was called Fripti. They were great. They provided me with like important reading materials on studies that had been done in certain areas of our field that they knew came up a lot on the exams. Provided me with quizzes and test exams too. So it's almost like what you would pay for a ACT test prep, but just tailored towards speech and language pathology. And then I joined some Facebook study groups as well, and they were really helpful in some of the like quiz questions that I might have been struggling with. We all kind of talked about it and worked through it together. So that was really helpful too, to be able to kind of pick each other's brains and figure out why this answer was better than this one, and things like that. But yeah, just using a lot of different resources, also studying with classmates as well was really helpful.
Yeah, that does sound really helpful. So yeah, you had good strategies then.
Mhm.
And so do you feel like when you came to take the test, you were prepared and felt like that helped you?
Yeah, yeah. Luckily, I just took it once. That was it. So yeah, it definitely helped prepare me for everything. Just one and done. Passed it right away.
Good, good. But if people do fail, they can take it again.
Yeah.
Okay.
I believe it's you pay for the test and then you go and you take it, and then if you don't pass the first time, you have to wait like a certain amount of time before you take it again because they have to have time to come out with the next version of the test so you're not taking the same one again. But I can't remember if you have to pay another fee at that point or if it's like a discounted rate. Um, but yeah, I just remember that it was like a chunk of time you would have to wait for them to come out with the new test.
Okay. All right. Good to know.
Mhm.
Good to know for our students. Um, can you talk a little bit about like networking and building connections in the field? Like, are there certain organizations that you network with, and
Mhm.
professionals outside of those that you work with in your clinic?
Yeah, definitely do a lot of networking inside my clinic. A lot of collaboration happens between speech therapists, occupational therapists, and physical therapists. And then we also collaborate across our different clinics as well. We have 3 locations, so we network within all clinics. I also network through LinkedIn with other SLPs in the area, other occupational therapists in the area. Conferences are a great way to make connections, especially with some of the leading professionals in the field. So I ended up following them on their Instagram pages to keep up with what practices they're doing and what's working for them in certain areas. I also follow some Facebook groups that are kind of like almost a study group, but they're for specific areas. So one is for the orofacial myofunctional disorders, and we can present with client permission some case studies and get opinions from other OMD professionals on what we might be missing in a case, why isn't this working, or what would you recommend as next steps. Um, I also would do some networking throughout just the community area with professionals such as dentists, ear, nose, and throat doctors, um, probably just like the teachers that my clients see at school, or if they're seeing a school-based SLP, I would be connecting with them. Some of my clients receive ABA therapy, so I'm connecting with ABA therapists. Just a whole bunch of professionals that you connect with in the area. But it's a lot of, most of the time, it's when we have a shared client and we're connecting to kind of create this holistic treatment plan for them.
Yeah, I like that. I like that. The idea of wraparound services again, and just like you said, holistic. So that's good. And I'm sure very helpful too to be able to bounce ideas off of each other and learn from other professionals and different strategies.
Mhm.
So yeah, I could see where that would be helpful. So what advice do you have for students who are interested in pursuing a career in speech language pathology?
I would recommend to go and shadow an SLP. It's easy to do. Just contact an SLP in your area. Say, hey, would you mind if I came and observed you with a couple of clients? I would also recommend, though, observing different SLPs in different settings because it's very different in each setting. So, like a hospital setting is going to be very different from an outpatient clinic versus private practice versus the school setting. So, if you're really interested in it, go and shadow a couple different SLPs, see which one you might like the most. And then you could probably do some research about some graduate programs that are in your area or in a different state that you're thinking about, and seeing which programs have what to offer because each program is going to be a little different. Some programs focus a bit heavier on certain areas of speech therapy than others. Some have an in-house clinic like ours did at Toledo, and others don't, where you're placed out into the community rather than having the in-house clinic. Um, I would also recommend looking at ASHA's website. So that's the American Speech Hearing and Language Association, and just kind of going through their sub-web page of speech and language pathology, and just kind of what the profession's about, what's required of the profession, and what steps you would need to take to become an SLP.
That's all really good information. Thank you for sharing that.
Mhm.
I think that's going to be really helpful for some of our students who are interested in going that into that area. So that's good. What I only have a few questions left. So knowing what you know now, what do you wish you had known in college and earlier in your career? I know you've given a lot of suggestions
Mhm.
already,
Yeah.
but wondered if you had any advice like that.
Yeah. I think one thing I wish I would have done in my undergraduate career is gotten a bit more involved in some leadership roles, um, just with throughout the departments for HDFS and Communication Sciences and Disorders. I think that probably would have helped me prepare myself for what was to come in graduate school, like time management wise, having that extra responsibility on top of coursework and learning some of those nuances of time management. Also, it's a great way to make more connections that way too, and then get experience being in a more leadership role before you enter the profession. So I think that would have been really helpful for me. And it was something looking back, I wish I had done earlier on.
Okay, good tips. Good to know. And so what do you see for yourself in your future in terms of your career?
hmm well, currently specializing in orofacial myofunctional disorders. So wanting to continue with that and at some point earn my COM. So that's certification of orofacial myofunctional therapy. That's kind of what's on the agenda for now, but um, just kind of exploring some other areas in speech therapy and seeing if anything else piques my interest. But as of right now, just focusing on OMDs and really honing in on a specialty.
Okay, so deepening yourselves in that area and then
hmm
maybe kind of broadening out to expand.
Yeah,
Okay, great. Good to know. And so my last question is it okay if students contact you if they have any questions?
of course. Yeah, they could connect with me on LinkedIn and send me a message, or they can feel free to email me with any questions they have.
Okay, great. So I'll include your email address in the episode description. And then, like you said, they could look you up on LinkedIn, Meghan Rich. Right.
Yes.
All right. So it has been really great having you on the episode on the podcast today. Thank you for taking your time to talk with me about your career journey. You provided really good information that I think is going to be helpful for current students.
Awesome. Thank you so much for having me. I hope I inspired some future SLPs out there to follow this career path. It really is a rewarding profession.
I think you did. Definitely. Thank you.
Thank you.
Thank you again for joining today's episode of the HDFS Career Podcast. I hope you enjoyed meeting Meghan Rich and learning about her career journey. As I mentioned in the interview, as Meghan and I talked about, her contact information is in the episode description, and you can also look her up on LinkedIn if you would like to reach out and ask her any questions. She'd be happy to answer your questions and give you information about pursuing a career in as a speech language pathologist. Please join me again soon for interviews with other professionals to learn about the many options you have available to you as you are pursuing your degree in HDFS. Enjoy the rest of your day.